Okay, everyone can see the heart through the camera, right?
Mm-hmm.
So this is so we can get a better view, or we can all follow along. So, really easy. Right atrium, right ventricle, left atrium, left ventricle. Good? Okay. Blood enters the right atrium from the superior vena cava. The inferior vena cava on the sheep heart is not on the bottom over here. It's actually on the back. So if you turn it a little bit in this way, you can see a little hole right back there. That's the inferior vena cava because the sheep is on all fours. Right? So there's your inferior vena cava. Coronary sinus, opening coronary sinus, too small to see on this model. All right, this little piece of tissue, like it looks like tissue paper. This is the tricuspid valve. It's all kind of messed up. So they're not going to ask you anything specific like the papillary muscle, which you can kind of see, or the chordae tendineae, which you can kind of see. They're just going to ask you the name of the valve. Right atrium, tricuspid valve, right ventricle. Right ventricle leads up this way. Here is the interventricular septum. This is a large piece of muscle. Right ventricle leads up through the pulmonary trunk, right here. Pulmonary trunk comes up and splits into the right, well, this is the left pulmonary artery, but that you can't really see. This little piece, when you shake it, holds those two together, that's the ligamentum arteriosum right there. Everyone sees that? Yeah. The little structure right here that holds the aorta and the pulmonary trunk together. Okay, blood goes to the pulmonary circuit, to the lungs, comes back to the heart. If you look back here, you can see the opening for the right pulmonary veins. The left ones would be cut out, right? But here's the left atrium. Left atrium passes into the left ventricle, the largest musculature in the left ventricle. Here, this little other piece of little tissue paper looking thing, this is the bicuspid valve, and you can kind of see the papillary muscle attached to the chordae tendineae right here. It looks like little strings. Now, I didn't go over the semilunar valves yet. The pulmonary semilunar valve is right here. It looks like, again, like a piece of tissue paper, and it kind of looks like this, right? Kind of looks like a little like door. So when blood pushes, it comes up. Kind of looks like that, right? And that's right there. We're looking for that same shape for the aortic semilunar valve, and that we can see, if we look really closely, we can see in there, where it kind of looks, again, like this. Very, very tiny right there in the back. Anyone see that?
In the video.
Right there. That little piece, that's the aortic semilunar valve. Blood comes up, goes up the aorta, which would be back here, right? And the aorta has it split. On the sheep heart, instead of 3 vessels coming off the aortic arch, it's only 2. It's only this is the brachiocephalic trunk, and this is the left subclavian. Technically, this is the aortic arch, and it'll go into the left subclavian, but the brachiocephalic trunk will split into the right subclavian, and then both common carotids. Does that make sense? Yeah. So brachiocephalic trunk, aortic arch, and that will eventually go into left subclavian. Questions with this model? Easy? Kind of tough, right? Looks kind of tough.
They'll bring these out during the exam?
No, they'll give you a tray. They'll give it to you on a tray.
Oh.
So, stop the video.